Hi, it's Mark, and I'm here at the AIDS Healthcare Foundation's thrift store. It's called Out of the Closet. We're here in Fort Lauderdale. How much is this, sir?
$21.99, I think.
$21.99?
Yeah.
This is a deal.
For you, we make a discount.
This is Jason King. He is the patient advocate here for the pharmacy of AIDS Healthcare Foundation.
Correct.
Is that right?
That's
Mark
right.
King, Jason King. I could be your daddy.
Today you will be.
Oh, really?
Yes.
I like that. You know, I could will you my whole empire, my fabulous disease
Awesome.
empire. It could all be yours, son.
Give it to me.
All right. We are here because we're going to help you save money on your medications. You help people do this all day long.
Every day.
We're going to show you 7 tips on saving money on your medications right now.
We all have the same condition. It's called life. I'm living mine as a gay man and an addict in recovery who's dealing with aging and being a friend and finding happiness and staying healthy and having fun and enjoying laughter, all while living with HIV for more than 25 years. I'm Mark S. King, and this is my fabulous disease.
Hi, it's Mark again. I'm here with Jason King. We're here at one of the pharmacies for AIDS Healthcare Foundation, and we're going to give you 7 ways to save money on your medications. Are you ready to go?
Let's go.
All right. Number 1, copay assistance cards. What's a copay assistance card?
Copay assistance cards are designed for patients who are insured. They allow you to save money on your copays, and the companies actually subsidize the insured patient by paying for some of their copay.
In other words, if I got insurance and I have a $35 copay on one of my drugs, they'll wipe it out with this card.
Most of the time it can do that. For instance, with my medication it does so. Depends on what the patient's copay is, but normally it will wipe out a substantial amount.
Now there are some restrictions on the copay cards, right?
There are.
And what is that?
Unfortunately, at this time, Medicare and Medicaid patients are not eligible to use copay cards.
And how much money? How much money can they save on this?
Sometimes up to $400, $500.
Up to $400. Well, right away, we are saving people money, right?
Absolutely.
The number 2 way for you to save money on your medications is consider a specialty pharmacy. Now, a specialty pharmacy is a pharmacy that specializes in something or another. For instance, HIV. AIDS Healthcare Foundation specializes in HIV.
Yeah, some of the things we offer are free vitamins, free therapeutic antioxidants. We do free delivery anywhere in the area, and we'll also do free shipping to anywhere in the continental United States.
All these copay cards and stuff, it can get confusing. There's several cards for several different pharmaceuticals. You'll help organize all that for
The
us.
specialty pharmacy is also very equipped to help the patient save money, and they're equipped to navigate the public and the private sector to do this.
And I will say that all the years I was at Walgreens, I don't remember them ever showing me a copay card.
Yeah.
Now, Jason mentioned free supplements, and I got to tell you, that was a big selling point to me.
The idea is to promote the whole health of the patient. We also offer the free therapeutic antioxidant for free. If there is a patient that requires something specific, we will try to work with that patient to the best of our ability to provide that to them for free as well.
Now, I know you're thinking, I live in a smaller town, there isn't a specialty pharmacy nearby. Do a little research, get online, because a lot of these pharmacies will ship out of state. You know, you can set them up. There are ways to work around this, and sometimes the advantages really make it worth checking out. Now, put your hands over your ears. Close your ears. There are other specialty pharmacies. They're not the only one. There's TomCare, there's BioScript. There's other pharmacies like this, specialty pharmacies. So you want to check out to see what's in your area and shop around. The 3rd way to save money on your medications is something called getting your AIDS drugs online through generic medications. These are companies online that get generic versions of our medications from first world countries. It's exactly the same medication, except these are cheap. They are a fraction of the price of the regular retail value of that medication. And most of them are made in India, actually, which is the 2nd largest pharmaceutical industry in the world. These are FDA-approved factories. There's nothing really to worry about there. A person is allowed to import a 3-month supply for personal use of a medication from out of the country. So this is legal for you to do. There's a website you can go to. It's called pharmacychecker.com. If you go to Pharmacy Checker, that's a good way for you to find out if one of these online pharmacies are good. Who uses these sorts of services? Usually somebody that has no insurance, obviously, and they're looking for an inexpensive alternative, or maybe you're in the donut hole and you can't pay 100% of the cost of that medication. Well, go to one of these services online where you get it from one of these first world countries, and you're going to save a lot of money. We have Jason in a soundproof booth during this period, and I have one more to tell you about before he comes back, and that is compounding pharmacies. Now, a compounding pharmacy is a pharmacy that produces versions of medications that aren't currently available but are prescribed by your doctor. Let's say you need 400 milligrams of a drug instead of 300 milligrams. A compounding pharmacy can provide that for you. This is a tip for those medications of yours that are not HIV specific, like Androgel, for instance. Oh, welcome back, Jason.
Hi there.
Hi, I wasn't talking about anything while you were gone. We were just chatting.
Great.
The number 5 thing that you can do to save money on medications is free post-exposure prophylaxis medications. This is a little tip just for you HIV negative folks out there. Hey, negative folks. Look, post-exposure prophylaxis is when you believe you are at risk. Maybe the condom broke, or you took a risk last night somehow, and you're afraid that maybe you have exposed yourself to HIV. Then what happens next?
The doctor simply has to send in a letter of medical necessity, and as long as the patient has begun therapy within 72 hours, they will qualify for free assistance for the duration of the month.
But that sounds like a lot of paperwork. You got to get on the phone, you got to have your doctor fax this medical necessity thing. You've only got 72 hours.
Right. Well, sometimes what AIDS Healthcare Foundation will do is we'll provide the medication to start, and then we'll assist that from that point forward.
So you'll do it. And you know what? There's a lot of HIV physicians that if you just call them up and tell them what the deal is, they'll give you the meds. I mean, they'll give you the meds, and they'll do the paperwork on the back end. The number six way to save money on your medications is through donut hole assistance. How many of you have insurance and you get stuck in that damn donut hole where you have to pay the full price of medications? That sucks.
It does suck.
So how much do you have to pay in that donut hole?
Approximately $4,000 and shrinking due to Obamacare.
Really? So
yes.
It's getting a little lower each year. But that's still $4,000. I can't afford $4,000, can you?
Neither can I.
So what can you do to help me with that sort of thing?
Some HIV drug manufacturers will assist in this area. When you get into the donut hole, for instance, Gilead will help pay for your medication for the duration of the year.
But of course that doesn't account toward the donut hole.
No.
My other meds will have to count toward the donut hole. And this is along the same lines. Number 7 way to save money on your medications is through patients assistance programs. Now, unlike the donut hole stuff, Jason, in patients assistance programs, we're talking about people who have no insurance at all.
Right.
How does a pharmaceutical patients assistance program help them?
Well, the patients will appeal directly to the manufacturer that makes these medications, and it's an application process. They submit the application along with all the required information, and based on their income, and every pharmaceutical company and program has a different income requirement, they can get their medications at no cost to them from anywhere between a 1 and 3 month supply.
Now, you told me there was a website that people could go to kind of get assistance on all of this patient's assistance stuff, right?
That's correct. They can go to needymeds.org.
Needymeds.org. And what will they get there?
It has information about copay programs, financial assistance, patient assistance programs, patient advocacy groups, lots of information.
And those are 7 ways to save money on your medications. You were such a good sport.
Great, I'm glad I was here to help.
You were here to help. You're a good patient advocate, Jason.
Thank you.
Thank you very much.
Thank you.
Height. It's all about height.
Okay.
Okay? Let's see you. Come on.